Hello viewers, last week we have announced a program called ANDROCARE Connect. So now in this program we will be doing one video once in a week or once in 2 weeks depending on the number of questions, which are basically they are either questions or comments which are in the comment section in our YouTube channel. So now this is for English channel. So now we have actually two channels. One is a Telugu channel which is called as ANDROCARE Andrology Clinic, and our English channel is ANDROCARE Andrology Institute. So there are so many people asking for Telugu videos. So all those Telugu videos are in ANDROCARE Andrology Clinic channel, and for English videos you can subscribe this. This is in this channel we will be dealing about only English videos. So now first question is the one patient who said he did too much of masturbation and it caused ED. Masturbation chesi ED vachindi sir. Okay. See, now generally too much of masturbation only can cause ED. Too much, that means people who are masturbating 2-3 times in a day, 4 times in a day. So that is the only in that scenario you can get ED with masturbation. Otherwise, people who are masturbating once or twice or thrice in a week, generally they don't get erectile dysfunction. But people who are doing prone masturbation, that means those who are rubbing the penis on the bed, and that is how they do that is what called prone masturbation. So even in prone masturbation there is minimal risk of erectile dysfunction. Otherwise, regular masturbation will not cause erectile dysfunction. So second question, for erectile dysfunction, arteriogenic insufficiency after taking piezo shockwave therapy, maximum how many days we have to wait for to form new blood vessels. Okay. See, normally piezo wave shockwave therapy it is in 4 to 6 sessions. For some people we give 4 sessions. For most of the people we give 6 sessions depending on the severity of the damage, vascular damage. So normally what happens, first 4 sessions major difference may not be seen. In generally first 4 sessions only those enzymes which are responsible for blood vessel production like VEGF2 factors, they are released in the penis, and after 4th session they will start working and they will start producing new blood vessels. They will help in producing new blood vessels. Generally it takes around at least 1 month after shockwave therapy to see good results. So you have to wait for 1 month after shockwave therapy. And other question, Satish Kumar from Medak. Sir, please translate your videos in Telugu. Okay. Already I told you, already we have a Telugu channel called ANDROCARE Andrology Clinic. We will send you a link of Telugu channel here in this question. Please subscribe to our Telugu channel for all those Telugu videos. So one more subscriber said, videos are too short, it must be at least 8 to 10 minutes. So some videos, see, basically if the matter or the topic what we are choosing, we can actually speak on the topic for hours together also. But what happens is, there are many people who are looking for crisp answers and exactly pinpoint question and answer for what they are looking for. If I make too long video, they may lose interest, and most of the people, they are not watching complete video, they are just skipping to the end and they are seeing what is there in the end. So now that is the reason we are doing short videos of around 5 to 8 minutes, but we are trying to cover all topics in that video. And if we think that the topic needs 3-4 different videos, we are actually making all those videos which are necessary. And one more question, make a video on penile implant and its pros and cons. Definitely we will be actually making at least 15 to 20 videos on penile implant, and we are just waiting for a patient who is ready to talk to patients. See, we don't want to show his face, but patient should come forward. We can mask the face. We can tell his experience with our YouTube channel subscribers. And regarding penile implant, will be doing at least 15 to 20 videos. Please wait for those videos. And one more user said, Naga Prasad, he said his vitamin D is low. He said vitamin D is around 29. You don't have to worry. The minimum value is around 30. So your vitamin D is just on the borderline. So you don't have to take medications. Daily 5 to 10 minutes, if you can get proper sunlight and take milk products, milk and buttermilk, these things will have vitamin D. Sunlight is actually enough to get enough vitamin D for you, because it's not too low. If you want to take medications, vitamin D medications, only take 4 tablets. Any company, any brand vitamin D tablet with 60K strength, once in a week with breakfast or immediately after breakfast, once in a week for 4 weeks, that is enough to improve your vitamin D. And one more question is, my age is 47, my testosterone level is 288. Any chance to increase testosterone level? So for your age, your testosterone should be at least 300 to 350. 350 should be ideal testosterone for your age. So 288 is slightly on the lower side. I don't say it's very low. So you can increase it with regular exercise, regular sunlight exposure and regular exercise. And there are so many foods which can boost your testosterone levels, or you can take ashwagandha, you can take shilajit, all those supplements, natural supplements which can boost your testosterone production. If in spite of doing all these things, if your testosterone is not increasing, then you can consult a doctor. Regarding shockwave therapy video, one subscriber asked us, what is the success rate of this therapy? If your problem is identified in early days, that means if your vascular damage is in early stages, then the success rate of this therapy, shockwave therapy for erectile dysfunction, is around 70 to 80%. But if your problem is too severe, that means if your blood flow in the penis is very low, or most of the blood vessels are already damaged in the penis, then success rate is around 50 to 60%. It depends at when we are starting this therapy. So one more question, sir, Telugulo cheyandi please. Okay, again we have a YouTube channel in Telugu. It is called ANDROCARE Andrology Clinic. Please subscribe that. Sir, do a video on neurogenic erectile dysfunction. Definitely will make a video on neurogenic erectile dysfunction, but why we are not doing, we didn't do is, it's a severe form of erectile dysfunction. Neurogenic means damage to the spinal cord nerves or the nerves which are supplying to the penis. So in this, generally no medication or no shockwave therapy will work in neurogenic erectile dysfunction. Most of these people will end up with either vacuum pump or penile implant. So since there are not many treatment options for neurogenic bladder, we didn't do a video. Anyway, we'll do a video and we'll say how penile Doppler will help these patients. So one more comment says, sir, Hindi may be video. Okay. See, my Hindi is very poor. I can actually talk to a patient in Hindi and I can communicate with him. But anyway, I'll try to make some videos, at least some videos in Hindi. Thanks for the comment. Sir, prostate cyst or enlarged dilated seminal vesicle with pain. Okay, one video. Okay, I think already we covered this. See, prostatic cyst and chronic prostatitis, all these are almost same. So just watch my chronic prostatitis video, and these prostatic cysts are very common. Sometimes small cyst, you don't have to worry. You don't have to, if there are no symptoms, you don't have to worry. If there are symptoms, then symptoms are equivalent to chronic prostatitis. So just watch our chronic prostatitis video. So one more subscriber asked us, doctor, please do a video on prostate massage, and prostate massage will relieve all symptoms or not. See, when we started our clinic in 2014, those days when there is no shockwave therapy, so we used to do prostatic massage for every patient with chronic prostatitis. So though this is a painful process, we used to call them every week and we used to give a prostatic massage. But it's a painful thing. So now after this shockwave therapy, generally we don't need that painful treatment for chronic prostatitis, because it can never cure your problem. It will only give, prostatic massage will give you only temporary relief, whereas shockwave therapy will give you at least permanent or long-term relief in at least 70 to 80% of the patients. That is the reason we are not doing prostatic massage. So one more comment says, good job doctor, sharing information to the patients. Thank you very much. Okay. And one more question, do you have a video on how to increase testosterone naturally? Recently we did a video, and see, there is one old video, and even last week we did a video on how to increase testosterone naturally. Please watch it. One more question is, appointment very late sir, maybe 3 months or 4 months waiting. I did a video on this in my Telugu channel, why it was getting late for us, but now one more doctor joined us and another doctor will be joining next month. So probably all these delays in appointments will be sorted out in 1 month time. Now already we started calling many patients, those where we have given appointments in March, April also. Now slowly we started calling them for the clinic. Probably if you give us around 2-3 months time, we will make sure that your appointment you will get appointment in 1 or 2 weeks time. So one more comment says, 4 months ago my penis size is 7 inches, but now it has become 4 inches. So now in this case, see, now only 2 things can decrease your penile size in 3-4 months time. One is very low testosterone, and second one is chronic prostate infection. So now only when there is very low testosterone, then penis looks like penis generally it shrinks in size. But once you increase your hormone, generally it goes back to your normal size. You don't have to worry. Sometimes even chronic prostatitis also you will see this, and chronic, that means severe penile vascular damage also can cause this, but that is difficult to treat. But in 4 months time, from 7 inches to 4 inches, that is not common. Anyway, this can be treated, don't have to worry. I think that's all for this week. So you keep posting your questions in the comment section. Every week, depending on the number of the questions, every week we'll try to make a video to answer all these questions. Thank you very much.